welcome to the Monday morning COVID-19 briefing. I'm Megan Pearson, your Chief Communications Officer, and today we have with us Matt Constantine, our Director of Public Health, Ryan Alsop, our Chief Administrative Officer, and Russell Judd, the CEO of Kern Medical. First, I'm going to hand it over to our Director of Public Health.
Thank you, Megan, and good morning. This morning we are announcing we have 86 new cases in Kern County residents for this morning, and there are no new deaths. Our skilled nursing facility team continues to be active. We continue to hold daily calls with Kingston and Valley Convalescent, and as I reported last time, 12 of our 19 skilled nursing facilities are reporting positive cases in healthcare workers. So that is significant. Our skilled nursing facility testing team is active again this week. They will be at Windsor Acute Post Care this morning and tomorrow. They'll be at Delano District Skilled Nursing Facility on Wednesday and the Kern River Transitional Care on Thursday. As I talked about last week, the state has come out with some modeling tools that I'd like to speak about briefly now. They have provided counties with some new modeling software. It's web-based that allows us to put into the system local variables so that it provides some modeling for us so that we can start to look at what actions we need to take to ensure our healthcare system remains strong and active. This state modeling system allows us to predict total expected hospitalizations and also predicted ICU hospitalizations. We can put into this system variables that include our population, our local hospitalization rate, our ICU rate, our number of beds and ICU beds, when Kern County implemented interventage, and also the degree of compliance that our community is following up with. The state has indicated that these modeling predictions are good for the next 30 days, but after that, the forecasts become less reliable, but still something that we should be looking at. And it also assumes that conditions remain the same. So for hospitalizations in Kern County, the model is showing that we will not expect to see a peak in Kern County hospitalizations until early February of 2021. The model is predicting that we will have 679 hospitalizations at that period of time. Now, locally, hospitalization capacity remains high. Today, we have 911 beds available. So, although we want to keep everybody out of the hospital as possible, hospitalizations is not our primary issue today. Where we are focusing our time is what the model shows for intensive care unit beds. And I'm going to ask KGov to allow us to show the model that the state has provided us. And that model shows that we will exceed our normal ICU capacity on July 28th, 2020, and that right now stands at 78 beds. So the model shows that we will actually go above that normal level of ICU beds on that date. That causes us some concern. And that is that horizontal line, the first horizontal line you see. The second horizontal line, the pink horizontal line, shows the local hospital's ability to create additional surge capacity in our ICU beds. That capacity allows us to move those beds up to 294 beds. However, the model shows that we will exceed that on November 13th of 2020. The model shows that we will have a peak similar to hospitalizations in February of 2021 at 436. So again, it's important to understand that this is a model. it allows us to use this information so that we can make some plans for what we need to do to make sure we're safe. The model shows that we need to do more. We need to continue to flatten that curve so that we have the ability to care for everybody that we may need to put into an ICU bed. We have done a lot of work to this point. The last more than 2 months have been effective at flattening that curve, bringing down that peak. We need to bring it down even more. So this is a good time for us to recognize that we need to continue to take those actions that have been proven effective. We need to just reemphasize the need to stay apart when you're sick, to wear masks when you can't, to follow those recommendations. They work, and they'll work to get this ICU capacity or bell curve down even more. I'm going to ask that Russell Judd later on in this briefing provide you some overview of what the hospitals have done and what they are doing to ensure that we can care for everybody we need, and we'll certainly be able to answer any of your questions that you have. With that, though, I'm going to turn it back to Megan to talk about testing.
Thanks, Matt. We still have several sites open, and we continue to open new sites. A couple of changes have occurred in the last few days. So on Friday, we closed down the walk-up site at the Kern County Fairgrounds, and that site has now reopened or will be reopening in Wasco, hopefully in the next coming days, and that will be at the Wasco Library. If you're looking for that address, you can find it on the COVID-19 testing button on kerncounty.com. Mojave Veterans Hall, Kern Public Health, and the Kern County Fairgrounds drive-through locations are still open. The following locations are county-sponsored sites that remain open as well: Oildale, Taft, Delano, Kern River Valley, Ridgecrest, Tehachapi, and just opening today is the Lamont location at the Kern County Library. That's at 8304 Segru Road in Lamont, California. They have all the registration information on our website. You can give them a call. That is a drive-through and a walk-up site. You do need an appointment, so please make sure that you gather that information together before you get there and make your appointment. With that, I'm going to turn it over to our Chief Administrative Officer, Ryan Alsop.
Good morning, everybody. In Kern County, we've tested 40,000 residents for COVID-19. 36,000 or 90% of those tests have come back negative. We're seeking the results currently of 777 or 2% of those total tests. And we've got 3,367 residents, or about 8% of that total, who are positive. Today, of the 3,367 residents who've tested positive, 3,240 or 96% of those have either fully recovered or are currently recovering at home, treating their symptoms on their own. That 96% has been consistent on a daily basis for at least since March. So I think that's an important number to point out. We've got 74 residents, or 2% of the total tested, in the hospital. And unfortunately, we've had 53 people, or about 2% of the total tested, who have passed away. Again, over half of the deaths are attributed to several state-regulated skilled nursing facilities in our county that we continue to monitor. Our Kern Recovers program, I wanted to make a couple of comments about that. The forgivable loan program that we are doing, we're at about $2.5 million today. We're continuing to provide money to small businesses throughout Kern County. This is financial assistance. The first 2 weeks of that program, we were targeting those businesses most severely impacted due to the governor's order. These are the non-essential businesses. Today, we are now, if you are a small business in Kern County, whether you are a non-essential business or whether you have been an essential business, you are eligible for this funding today, as long as you have not already received a PPP loan from the federal government. We are not prioritizing those businesses today that have received a PPP loan. If you have received PPP, hang on, be patient with us. Let us get money out to those folks, those businesses who haven't received any financial assistance to date. We appreciate your support, and we know that you are in line, and we will get to you at some point. We're pleased with this program. Again, you can get details on this program if you're a small businesses at kerncounty.com. It's right there front and center on our website. The Board of Supervisors tomorrow at their meeting will be hearing recommendation and discussing a distribution program for PPE. This is personal protective equipment for small businesses within in Kern County. The county will be bulk purchasing these items and distributing these items. We're targeting about 5,000 independent small businesses throughout the county. We're going to have 16 locations that will be used as distribution points throughout the county to get this PPE out to these businesses. We will be giving out 2 weeks supply. Once you go through that 2 week supply, you can come back again and get another 2 weeks while supplies last, while money lasts. We're going to be spending about $5 million on this particular program. This is money that's made available through the Federal CARES Act. So stay tuned for that information. Our website should be updated with information on this following the board's discussion on it tomorrow, and should be up later this week, kerncounty.com. California reopening. So more and more businesses are reopening. The state is providing a pathway for businesses to reopen. They are issuing guidance. In fact, most businesses in the state of California and here in Kern County can begin reopening with adaptations and under state guidance. State guidance has been issued for most businesses. We are still awaiting guidance on youth sports activities. That has not come down from the state yet. So if you're asking about that, we just don't have guidance. The governor came out last week and extended for another 3 weeks the limitation on churches throughout the state and here in Kern County. Churches need to be only operating with about a 25% capacity for their facilities, or no more than 100 people for services. The governor has extended that period of time for an additional 3 weeks. We will be, if churches have questions about that, they can contact Public Health here locally, and we could help walk through and make sure that everybody understands what the state is directing on churches. Last week, the state issued a whole set of guidance documents for a wide variety of businesses. Late on Friday, we got guidance for nail salons and tattoo shops. We also got guidance for movie theaters. So in the state of California and here in Kern County, if you're a nail salon or a tattoo shop or a movie theater, you can begin reopening with adaptations and under that state guidance. Again, if you have any questions about that, you can contact local public health officials, and they can walk you through that guidance and answer any questions that you have. As we reopen, we talked about it last week, the state is continuing to monitor and work with all 58 counties on a daily basis, including Kern County, across a number of different areas, metrics, disease transmission rates, hospitalization rates, hospital capacity. We talked about these last week. As you may recall, the Bakersfield Californian published a story last week saying that the county was not out of compliance with certain state metrics. Well, into the weekend and today, we are back in compliance with the state's metrics across all their criteria. And technically, we should be off the watch list. And I point this out because we will be, on any number of these metrics that the state has provided, we'll be going up and down as we go forward, likely. And while that is certainly confusing to most folks, the reality is that we will be in compliance one day, we'll be out of compliance another, and back in compliance the next day. And so the important point is that we continue to monitor locally, working with the state across all of these metrics, and working where we see where we're trending in problem areas, whether it's hospital capacity, like Matt was talking about earlier, the testing rates, positivity rates, things like that. Where we see trends that are worrisome, we work with the state to address those and to make sure that we maintain compliance with those metrics that the state has provided. So again, at the end of the day, this is all about hospital capacity. Matt talked about it a little bit earlier. It's very important that we maintain our ability to serve those in our community that are needing hospital care. It's not just COVID patients, but it is every other patient that is needing to be hospitalized for any number of medical scenarios. And certainly, most importantly, the ICU bed capacity, that needs to be maintained. And with that, we're going to ask Mr. Judd, the CEO of Kern Medical, to come up and talk a little bit about what hospitals are doing to prepare.
Good morning. Again, Russell Judd. I'm the Chief Executive Officer of Kern Medical. Let me first and foremost give my great thanks to the healthcare workforce that's out there. There are 10 hospitals in Kern County. Each of them is committed to the well-being of a community and the caring of individuals that need that care. Healthcare workers are united. They sacrifice. They put themselves at risk to provide the care that our community needs. So as just one part of our healthcare system in our county, let me thank all those who are out there giving what they can to provide care to those who need treatment. I can't emphasize enough how committed and unified the 10 hospitals are here in Kern County to do our part in making sure that we meet the needs of individuals who are diagnosed or become ill with this disease. We're also, of course, committed to all the other healthcare needs that exist in the community, and would encourage everyone not to delay care, that hospitals are safe. You can go there to receive treatment at a hospital, at your physician's office, at an ambulatory center, at a clinic. Please make sure you're not delaying your other healthcare needs during this current pandemic. The hospitals are prepared for this increase in patients that Matt has outlined. As you can see, an immense amount of effort to prepare in that graph above what our current capacity is for ICU beds to surge to a much larger capacity. The hospitals have secured additional protective equipment, have secured additional supplies, have secured additional ventilators, are training additional staff to care for those patients. We are sharing resources amongst each other in the community as hospitals and as physicians and as healthcare workers. So the hospitals are putting forth an immense amount of effort to be, again, coordinated and unified as we face this challenge. So have confidence to know that we're giving it our very best, that we're here. We will provide the services that are needed for our community. In that graph that Matt showed, clearly, though, we have the opportunity to flatten that curve, to use the appropriate techniques so that individuals don't become infected and don't need ICU stay. So we unite together as hospitals and as healthcare workers with county and with the health department, with everyone, to encourage social distancing, to encourage hand washing, to encourage wearing masks. Do not take this disease lightly. It is significant. It is deadly. It does cause ICU stays. It causes hospital stays. That you can help all of us and yourself and your family by maintaining the appropriate social distancing. Let me also add one additional request. Those individuals who qualify, if you've had COVID and you have recovered from that, please seek out the opportunity, if possible, to donate your plasma. You can contact, of course, Houchin Community Blood Bank and other plasma centers in our community. They will do the appropriate screening. The treatment of plasma greatly aids in improving their health of those individuals who have this disease. So it is a valid treatment. It's one that is proven to be effective, and so if you have that opportunity, donate the plasma. The plasma has antibodies in it that can help individuals who are sick. Again, we encourage you not to delay health care. Make sure that you're caring for yourself. You're taking all of your preventative measures that are necessary to control any chronic or acute conditions that you have. Be confident that you'll be safe. You will not be exposed to COVID if you come into the hospital. We're trained, policies are in place, you'll be safe. We're united, we're committed to the overall health of our community. Thank you.
Thank you, Russell. So now we'll begin with questions. I'm going to go down the list as it was provided to our media outlets. Remember that you have to use *6 to unmute. Please do not unmute until you're called upon. We have a couple outlets who have not dialed in, so we're going to go directly to those who are on the line. The first caller on the line is channel 29. Do you have any questions?
Hello, can you hear me?
We can, go ahead.
Great. It's Fiona with Channel 29, and my question today is about testing accuracy. So the FDA recently released a statement saying they're asking several COVID-19 test makers nationwide to do follow-up accuracy checks on their testing kits. So I was wondering, is this testing and accuracy an issue that Kern County is facing?
We're going to have, Fiona, we're going to have our lead epidemiologist, Kim Hernandez, respond to your question. Give us just 1 second. Thank you.
Sure, thanks.
Good morning. That is a good and very important question. Currently, all of the tests available for COVID-19 are part of the FDA's Emergency Use Authorization program and process. So all of them have met certain metrics in order for the FDA to grant them the EUA status, but the CDC has asked for many of the test manufacturers and developers to further and continue verifying the accuracy, the sensitivity, and the specificity of all of their tests. All of the ones that have been authorized by FDA under the Emergency Use Authorization are able to provide diagnostic test results, but as always, we're always looking further into which of these tests provide the most accurate and timely results.
Got it. Thank you very much.
Thank you, Kim. Okay, our next outlet is channel 17. Any questions?
Yes, it's Eitan. Can you hear me?
We can, go ahead.
Excellent, Megan. Thank you. First question I have is just going back to the model that Matt was talking about. Thank you so much for making it clear. Just about the numbers, I have a first question of, is where do he spoke about the number of beds available, where things go from here, what the model is anticipating for February, and et cetera. But where do they stand today in terms of hospitalizations, and how often is this model updated?
We'll have Matt answer that one.
Thanks.
Good morning. So if we could show the graph again, could Kegev turn on that model so that we could see that? So great question. If you look at the bottom left of the model, you will see that there is a blue line that is kind of what we're modeling after. The red line that kind of goes up and down along that is our actual data. So we are trending along that model prediction based on those actual numbers for that short period of time. We can update this model once every 30 days, and then it predicts out 30 days from that. It's important to note, again, that it is just a model, that there are some variables that affect it, and so it's early on, as you can see from the model itself, but it does show some concern about increasing hospitalization and ICU beds. Hopefully that answers your question.
Thank you, Matt. And as it stands today, though, things are okay right now, just to be clear, in terms of hospitalizations and ICU beds?
Correct. So currently, we have the capability to care for all those that need it, and we expect, especially based on the surge capabilities that the hospitals have pulled together, we believe we can provide the care needed for a long period of time, and in hopes that that period of time we're able to bring down those cases, those expected cases, so that they remain below that surge ICU line.
Thank you, madam. And my other question for you is just a follow-up kind of, I believe you mentioned, and correct me if I'm incorrect, that part of the model, you mentioned all the factors that go into the model. That includes, you mentioned how closely, to paraphrase, and I am going to paraphrase here, how closely Kern County is following the steps, right? Following the social distancing and whatnot. How is that looking right now?
So that is by far the most significant variable in the model. By increasing our compliance with the CDC and CDPH recommendations, we can significantly affect the number of expected cases. So we are doing well. We've said this from day one. I think we've done very well on heeding the advice. The model shows that we need to continue those efforts, and although we want to think that COVID-19 is something that has passed us by, the model is showing that we still have some challenges ahead, and that we need to really double down on our efforts collectively and individually to keep those numbers down. So the model is really a good way to picture what we need to continue to do for the coming months.
Thank you very much.
Okay, our next outlet on the line is the Bakersfield Californian. Any questions? Don't forget.
Hi, this is Stacy.
Go ahead.
Yes, my question is, when I'm looking at the model, Matt, I assume this question is going to be for you. This is only showing ICU predictions, correct? And, if so, it shows that we're going to surpass our, regular ICU capacity in July, and then potentially the surge capacity looks like December. Will hospitals be activating the surge capacity plans at a certain time point based on this modeling? That's my question.
So we're going to have Russell Judd, the CEO of Kern Medical, respond to that first.
Okay.
So from the very beginning of this pandemic, all the hospitals, as requested by the state Department of Public Health, has asked us to develop a surge capacity. And so that capacity has been developed. We have very clear and defined plans of how we meet that need. Along the way, of course, we have to implement that surge plan as needed. And so I can speak for Kern Medical on how we're doing it, that we have triggers along the way, and I'm assuming the other hospitals have very similar mechanisms in place. And so when a trigger is hit, meaning that we've hit this capacity, we go to phase A of our surge capacity. And then along the way, if we hit the next trigger, then we open up the next phase of that. And so it is a very clear plan. We know where we're headed. We know what our pathway is, and there are triggers along the way that when we hit them, we open up and are prepared to handle the next level of care or surge that will be required.
And if I could just quickly follow up on that, and thank you for that response. What happens if we hit a point where the surge capacity for ICU beds is exceeded? Since the model seems to be indicating that will happen like toward the end of this year.
So I would add that this is a model. And I think the reason we're pointing it out today is this is one of the potentials, but it can be altered. This graph does not need to be followed. This is a proposed, it may happen, and I'll really emphasize the word may, that if we can change the outcome of this, we don't have to increase and go over our surge. If people will be social distancing, if they'll hand wash, if they'll wear masks, if people follow the recommendations, this graph does not have to become our reality, and we can stay well within the capacity for us to manage.
Our next outlet on the line is Kern Radio. Any questions?
Yes, hi, it's Ralph Bailey. Good morning.
Go ahead.
With the survival rate staying so consistently high, is there any guess as to why the ICU rate is increasing? And at what point does a patient get transferred to ICU? Is that the point where they have to live on a ventilator? And are you guys monitoring the ICU survival rate? How many patients are coming out of ICU?
Thanks, Ralph. I think we're going to have Kim respond to your question. Give us just 1 second.
Hi, Ralph. Good morning. One of the largest factors about the number of patients in the ICU is that patients who are in the ICU tend to stay in the ICU for a long period of time versus general hospitalizations. You may be hospitalized for a day, you may be hospitalized for a couple of days. Once you're admitted to the ICU, chances are you will be in there for several days. And so obviously if we have a new patient every day, that compounds very quickly. As you mentioned, we have had several successful stories coming from the ICU where patients have been cared for successfully by our local hospitals, and they've done a tremendous job of caring for all of these patients. And we've had several of them as our public health nurses and our public health staff have followed up with these patients, where we've been very happy to share with one another that patients have left the ICU, have discharged from being hospitalized, and have recovered and are home. We haven't specifically counted all of them up, but I can tell you anecdotally from several opportunities for our staff to share with each other some of the successes we're seeing in our community, that we have had a number of patients who have had to be hospitalized in the ICU and have recovered, and we're very glad to be able to report that to our community.
And at what point is the patient transferred to ICU? Is it the ventilator? Is that what makes it necessary?
A ventilator is certainly a part of the decisions for medical providers to transfer patients into the ICU. It's a medical decision that's made among the healthcare providers, and it may be vent support, it may be additional comorbidities that a patient has, but the healthcare providers have this discussion, and when they determine that a patient needs additional support, that's when they get transferred to the ICU.
Thank you. And finally, just one other question, and this might be for Matt, but are we housing patients from outside Kern County?
We'll have Matt respond. Hold on.
Good morning, Ralph. Yes, hospitals generally operate on a regional basis, and it can be where hospitals bring in patients from outside. It's not very common. Some have contractual arrangements. Some other counties or areas, and what we've seen in Imperial County, are inundated and have asked for help. So hospitals have that ability to bring in people from the outside. Again, it doesn't happen a lot in Kern County, but there are some. Yes, sir.
All right, thank you.
Next outlet on the line is Channel 23. Any questions?
Hi guys, Bayan Wang here. Thanks for having me. Hope you guys are all doing well. I have kind of a two-phased question here. I know Ryan Alsop was talking briefly about being in and out of compliance, kind of flirting with the metric there, and anticipating that we're probably going to be in and out as we continue to reopen. I guess my question is it kind of, we go on that watch list? Is there a number of days that we have to be out of compliance in order for us to scale back some operations? And if so, what is the county looking at scaling back if we do have to take that step?
Okay, Brian, we'll have Ryan respond to your question.
Thank you.
Hi, the quick answer to your question is no. There are not a number of days that if we go over, then there's an action taken. Again, we are looking across these data points, and the state is looking at them. We do them on a daily basis. We have daily discussions with the state, and where we were out of compliance, I think, across at least a couple of different areas. Last week, we went into the weekend, and we are below all of the numbers that the state is requiring us to meet. We were going into the weekend. We are today. In fact, we'll go down even lower tomorrow. And I don't want to tag this to reopening. I've not said that our numbers are going up with reopening, although that's entirely, there could be a correlation. I think it's too early to know that yet, given that businesses and this guidance is just being provided, and businesses, many of which just got their guidance last week or the week before. So time will tell there. But again, this is a daily conversation that we have with the state. I can tell you that there are other counties that have been out of compliance with their metrics for weeks and weeks, and they're continuing to talk with the state. They have not. They've continued to reopen with the guidance. Local public health officials, state public health officials believe that this guidance, if followed, depending on whatever industry you're in, if you're following this guidance and implementing it, practicing it with rigor, you should be fine. You are limiting the potential for spread, infection with the virus, and you need to be following the guidance. So this will be a daily thing that we'll be doing with public health at the state level, and where we again see trends that are worrisome across any one of those those data areas, we will work with the state to address them, figuring out why we're trending up and what can be done locally to get those numbers in line with where the state is.
Hey, Ryan, thank you so much. Second part of my question, I think this may be for Matt. You mentioned a few key variables. I don't know if you described exactly what they were for the model that project us to maybe have an increase in ICU patients by next month. If you did, I apologize for asking again. But what are some of those key variables that are anticipating that we're going to have such a high turnout in ICU patients next month?
Okay, Brian, we'll have Matt respond.
Good morning. Yes, we did mention that briefly. There are variables that go into the model that do affect where that bell curve goes. Everything from simple figures like population, but also hospitalization rates, what we're actually seeing here locally, our ICU rate, obviously the number of beds available. When the county implemented interventions plays a significant role in that bell curve. And as we've mentioned before, the degree of compliance. How well are we doing with disease transmission? How well are we doing with keeping sick people home from work and not shaking hands and keeping distance and wearing masks? Those all, but mostly that latter, has significant influence on the bell curve itself. Hopefully that answers your question.
Thank you.
Yep.
Yeah. Thanks.
Hey, Brian, one more thing I just thought of here off to the side. I wanted to just make a point, reiterate that that people are not going to be getting sick from businesses reopening. People will get sick because they're making poor personal public health choices. They are not wearing a mask when they're in close proximity with groups of people for a sustained period of time. They're not washing their hands regularly, multiple times a day. They are not cleaning surfaces that are in the public that are touched over and over again. They are touching their face, their eyes, their nose, their mouth. They are getting around sick people. it's also the choices that are being made by the businesses that are opening, their employees, these businesses making sure that they're following the protocols, the guidance, ensuring all of the employees at these businesses are following the protocols and guidance. But this is really not, it's less about businesses reopening, causing people to get sick, and it's more about individuals making not very good choices, doing all those things that we've all talked about ad nauseum here for many, many weeks.
Thank you, Ryan. Appreciate it. Thank you.
Okay, our last outlet is Kern Soul. Anyone on the line with questions?
Hi, this is Elizabeth again with Kern Soul. My question is, I just have a clarification question. There were a lot of numbers thrown out earlier when Matt was talking about the model, and one number was 911 beds available. So I just wanted to confirm, does that 911, does that mean the number of hospital beds and the number combined with ICU beds available in Kern County for patients who get COVID? Is that what that number is?
So we're going to have Kim walk through those numbers again. Give us just 1 second.
Okay.
So that's the total number of currently available hospital beds in all of our area hospitals. That fluctuates, and that does not specifically mean number of hospital beds open to COVID patients. Obviously, there's available hospital bed. Whatever your need is, our health facilities will fill that bed as needed. So it's not specific when we're talking about the number of available. When we're talking on the modeling chart that we have been showing today, that is modeling the number of COVID positive patients in the ICU at this time, as well as our total ICU capacity, so COVID or not COVID.
And does that include, are we factoring in the number of beds available at the fairgrounds?
No, that does not include the number of beds available at the fairgrounds.
Okay, thank you.
That was our last outlet. I'm going to pause for a second in case anyone has any last follow-up questions.
Yeah, this is Stacy with the California, and I do have a
I have
follow-up
one real quick question.
So Stacy, we'll go ahead and take your question first. Go ahead.
On the graph that Matt showed, can you guys say when exactly the model is showing that we passed that surge capacity? Is that like November, late October? Kind of unclear from what I'm looking at.
Yeah, Stacy, we'll have Matt respond.
Good morning, Stacy. So, although these numbers can change significantly since you're asking me for the actual date, but we show, as the model is run today, that we would exceed our normal ICU capacity on July 28th, 2020. We would exceed our surge capacity of ICU beds on November 13th, 2020. And our peak would happen on February 5th of 2021. Does that answer the question, Stacy?
Yeah, I didn't know you even had it down to the day. So,
Yeah.
Okay, February 5th, you said?
February 5th is what the model shows today. Of course, that could change significantly, but that's today what it shows.
Yeah, and then you made a comment, Matt, that like going out 30 days, the model becomes less reliable. Is that, looking out 30 days past today, or does that just mean like in 30 days you would need to run the model again to see what it looks like?
Well, both, Stacy. So the state is indicating that the reliability of the model is fairly good 30 days out, but with any forecast, beyond that 30 days, it is not as reliable, and that rerunning it every 30 days is helpful so that it updates our predictions and helps us understand where that curve is going.
And so do you plan to do that? Are you going to run it like every 30 days and give us an update, or what's your plan with this model?
Yes, absolutely. With the state's now information that's now available, that certainly would be our hope, not only for this discussion, but for discussions with the 10 hospitals so that we can do everything we can to make sure we're ready.
Okay, thank you.
Thank you.
Also, just a comment on the model as we look as a hospitals and are trying to plan that this is a model. Because it predicts that this may happen, I don't know what the probability of it is happening, but it is just a chance that it would probably be inappropriate to say that on this date we will run out of ICU capacity. That's an inappropriate statement to make that. This is a model. We use this as a mechanism to plan, but we also use this as a mechanism to invite people to change. If you looked at models that we looked at back in April, we would have been well above capacity today and have been in a very significant crisis mode. People acted, people made good personal choices, they washed their hands, they did all that was necessary, and at that time that model was averted. So again, I'd remind that this is just a model and it's just an estimate, and it would be inappropriate to say that we will run out at a particular date.
Okay, thank you.
And Ralph, I think that was you that chimed in with a follow-up.
I did. Thank you, Megan. How many ICU beds will be out at the fairgrounds facility?
None. Sorry. I'll have Matt respond to that more fully.
Was that a dumb question? I'm sorry.
No, that's not a dumb question. It's nice that Megan knows the answer. That's a very good question because we need to be ready. So the alternative care site was designed to hold a maximum of 250 individuals, but not at the ICU level. This is at a much lower level. So as we're having discussions with the hospital CEOs about what we need to do to flatten that curve and to prepare, we've thrown the ACS in the mix. If there's a way we can use the supplies and our ability at the fairgrounds to help the hospitals manage this surge, then we've offered that up. And we don't necessarily have to use it for, just as it was designed for COVID positive, low acuity hospitalized patients, but in fact, in any way that would help alleviate some of the stress and the surges that we're going to see in the hospital. So 250 beds, non-ICU.
Okay, great. Thank you.
Okay, I think that's all for our questions today. I want to remind everybody to wash your hands, wear your mask if you can't keep 6 feet apart, and socially distance whenever possible. That wraps up our Monday morning briefing, and we'll see you later this week. Thank you.